nasal packing, papasukan ng gasa yan. Okay? So, we will arrange for a very small cost. Yan ay ipapasok doon sa loob. So that the patient, okay, will not have bleeding and to absorb the bleeding from the operative side. And then we need to insert a catheter. Sa OR pa lang, meron ng catheter yung patient ninyo. And usually it is inserted so that we can monitor the urine output. Now, because any patients having a surgery, okay, affecting the pituitary gland and involving the pituitary gland or nearby the pituitary gland, usually will develop a complications of diabetes insipidus. So ngayon, i-monitor natin yung urine output. Now, ang urine output should be, ideally, will be 30 to 50 cc per hour. So ngayon, pag more than that, pag nag-100 per hour ang patient nyo, you need to report this to your physician. Okay? Kasi nga, ang pasyente natin is having this complication of diabetes insipidus. Then, of course, we're gonna review all the medications and provide a routine view of care. Now, I forgot to mention that if a patient is maintaining a drug, so usually this is lifelong. Tuloy-tuloy yung medication ng patient. Okay? So, post-surgery, so what we can do in here, we provide a post of care. Now, sabi natin, we strictly put the patients on bed for 24 hours. And pag after 24 hours, so what we can do, we need to encourage ambulation. Okay? To prevent complications of atelectasis. Kasi ang patient ninyo will have a general anesthesia. So, ang patient ninyo shall be encouraged to ambulate. Kaya lang, when the patient is allowed to assume a position, your client will assume a Fowler's position. Okay? Now, the reason why we need to put the patient on a Fowler's position because we want to prevent attention on the suture line. Yung suture nyo nandyan sa ilong ninyo. Okay? We don't want it to be compressed and because we wanted to avoid increased intracranial pressure. So, yan ang gagawin natin. Okay? Now, if we wanted to drain the secretions, so we can do your Trendelenburg position. Ayan. Pwede yan. Okay? And then, eventually, we need to assess the patient. So, next will be, remind the patient not to sneeze. Okay? Bawal ang suminga, bawal ang umubo, and then, bawal ang mag-bend over and blow the nose for several days to avoid disturbing the suture line. Kaya nga sabi natin, we need to expand the lungs. So you just instruct your client to do a deep breathing exercises. Kasi pag gumamit ito na incentive spirometry, the patient will blow. O, magbo-blow yan. So pag nag-blow forcefully yung patient nyo, baka mamaya mag-bleed yung kanyang incision, okay, doon sa kanyang suture line. So these are the things that we need to prevent. So in all cases, okay, ang instruction natin sa patient natin will be to increase to prevent atelectasis to happen. Your client should have deep breathing exercises and even they need to breathe through an incentive spirometry. Kaya lang sa pasyente ninyo with a transsphenoidal surgery, bawal mag-blow. Okay? So, kailangan deep breathing exercise lang. Okay? And it has to be done minimally. Now, when the patient experiences pain, so we need to give pain medication. And usually, this is routinely given to the patient 24 hours round the clock so that the patient will not develop pain. Okay? And will not feel the pain. So, post-operatively, so we need to anticipate the patient manifest the signs and symptoms of DI or diabetes insipidus. Kasi alam natin that your DI, okay, or your diabetes insipidus, so this is your antidiuretic hormone, so this is being produced by your pituitary gland. So ngayon, we have to be alert for the increased thirst and urine output. So alam natin yan, pagka may diabetes insipidus yung patient, urine output will be too much. So pagka too much ang urine output, that can lead to a stimulation of the thirst center, then causing the patient to have an excessive thirst. Okay? And eventually, ang patient ninyo will also have a very low specific gravity. Now, pag alam natin ang ihi na ihi yung patient, then we need to replace the fluid and we need to administer your vasopressin as ordered. Okay. Now, DI is solved within 72 hours. So, we have to report an output of approximately 900 ml per 2 hours for a specific gravity of 1.064. So, ito yung mga signs of a patients with diabetes insipidus. Now, post-operatively, okay, what we can do, we need to, the patient is required to be tested by an ophthalmologist. So, your patient will have a visual field testing to determine possible visual defect. Kung meron siyang scotoma, meron siyang hemianopsia. So, kasi guys, pag may bleeding inside your pituitary gland, it can also cause a compression of your optic chiasm. So that may eventually leads to a visual defect and even bleeding. Now, kayo, ang nursing care natin, ito yung titignan ninyo. So, any leakage of the CSF from the operative side. So, ibig sabihin, tignan mo dito sa ilong. Okay? Tignan mo kung nandyan, may tumutulong tubig. Tignan mo yung tenga kung may tumutulong tubig. So, ibig sabihin nito, we need to test. So, ibig sabihin, if this discharge is tested for the presence of glucose and protein, this is an indication that it is from the CSF. Now, you need to inform the doctor right away. Kasi guys, pag open yung inyong, pag naglilig ang CSF, so there will be possibility of improvement. So, it can provide an access for the microorganism to enter and the patient can develop complication like meningitis and you have your encephalitis as well. Now, provide emotional support. Kasi alam natin, patient ninyo will have an impairment of the body image. Katulad niya, nakikita nyo, meron siyang catheter sa ilong, meron siyang nasal pack. And of course, what is important, try to talk with the patient and reassure the patient that after several days, catheter will be removed and the condition improve. Okay? Now, we need to perform a range of motion exercises because we need to promote a maximum joint mobility and to prevent an injury due to a muscle weakness. So, if the patient is able to do the exercise, let the patient to have an active exercise done. Pero pag hindi pwede, so that the nurse has to do the exercise. So you will do your passive exercise. Kayo ang mag-exercise para sa patient. Then of course, we wanted to keep the skin dry and avoid using oily lotion. Because usually a patient having this condition may have hormonal imbalance. So it will keep the skin dry. So we need to clean, okay, the body. And then we use a lotion, but we don't use an oily lotion. Okay, so next, sabi natin, we need to provide the safety measure kasi ang patient natin may visual problem or visual disturbances. So if you're going to care for the patient, so ang gagawin nyo guys, always approach the patient on the side that is normal, hindi dun sa affected side. Kasi how you're going to talk with the patient if the patient cannot see you. So kailangan you approach the patient, you communicate with the patient, and you perform the procedure towards the unaffected side. Okay? Para at least hindi naman, just imagine, i-approach mo yung patient mo sa left yung walang vision. So, have to be able to see you. So, it has to be on the unaffected side. Okay? Because ang patient natin, meron siyang hemianopia or hemianopsia. Now, of course, sabi natin, because of the emotional lability, patient will have a mood swing. So, try to talk with the patient. Let the patient to verbalize yung kanyang fears, yung kanyang anxiety. At least in one way or another, patient's mood swings can be relieved. So, only the patient needs somebody to talk to. And you are there to be with the patient all the time. Now, the health teaching can include emphasize that hormone replacement usually needed lifetime. So, kailangan i-emphasize natin very strictly that the patient should never stop taking the medication unless nagkaroon